Ma'am, let me backtrack a bit. Give us a more accurate picture of yung sitwasyon ng mga nurses dun sa, on the ground. Kasi earlier we said 12 hours per day ang mga nurses. Pero from what I hear, it's not just 12 hours. It's more than 12 hours. Minsan
The
36.
duty, yes.
Di ba? So give us a more accurate picture of how it is for nurses at work, public and private, o magkaiba yung dalawa?
In terms of workload, Mr. Ed, actually, they have the same, no? The load should, the duty should be 8 hours a day.
Should be.
Should be, no?
Like everybody else should be.
Yes, but in actual, our nurses work from 12 to 16 hours, especially nowadays because we have understaffing in the hospital. And so the workload, also the patient load of our nurses increased from supposedly the standard set by the Department of Health is 1 nurse for every 20 patients. But they are taking care of average of 30 to 50 patients, even more, 80. There were even stories
80
from
patients?
yes, for every 8-hour shift. We also have stories from our nurses in the provinces where some nurses take care of all the wards in one hospital, 1 nurse to 1 hospital per shift.
That's about how many?
Oh, that's taking care of patients in, say, 9 to 10 wards in that hospital, which range from about 80 to more than or 100 plus patients.
You're talking about the public health sector only. Is it the same for the private sector? Because I understand the private hospitals also have a problem. And you're also asking for an increase for the salaries of nurses in the private sector. Is the discrepancy quite small?
Actually, the picture I just described applies for both public and private in terms of workload now. Although our nurses in the private sector have lesser salary, an average of 8,000 to 10,000 a month, smaller.
8,000 to 10,000 a month?
10,000 a month,
Below
true.
minimum wage?
That's
below minimum
even
wage.
below the
Yes.
minimum wage of 537 pesos per day,
And,
right?
and I also heard that in some cases, if you're a new nursing graduate, sila pa yung nagbabayad sa hospital?
Yeah,
Is this true?
for
Experience,
training
For
experience.
And it takes about 2 years before they are regularized. This is true?
Well, actually, the trend now is that most of our nurses are on contractual scheme. So there are many
rin
forms
sila.
of contractual scheme. They are called job order nurses, JO, or contract of service, COS nurses, or memorandum of agreement. And that makes it worse because a nurse under contractual scheme means there is no employee-employer
So
relationship.
basically, endo
So,
yung endo ng mga
yes,
nurse
they,
yan.
they have no benefits at all, and they have lesser salary.
Para saan ginawang sales lady?
Oo nga.
Oh, even
Oo nga.
some of our nurses are earning 7,000, 5,000 a
They have
month,
to be,
even lesser.
the contracts have to be renewed as well every about 6
Yes,
months.
every 6 months, true. So
talagang endo
there
talaga
is
siya.
no assurance of security of tenure.
Ma'am, very quickly lang po, although you're basically reminding people there's practically no distinction in terms of the experience, in terms of the work. But ano po yung proportion ng private nurses natin sa public nurses?
We have around 1,009 nurse hospital in the country, and 40% of that we have 1,009 private hospitals in the country, which is 60% of the total hospital that we have here.
Does that necessarily mean na mas marami ang private
Which
sa public?
means we have plenty nurses in the private sector than in the public sector.
Okay.
Kaso, mababa nga magsweldo.
Yes, mas mababa ang sweldo. For the government nurses, they receive an average of 18,000 to 20,000 a month. That's the average compared to 8 to 10,000.